That was a wonderful meditation session to kick off Saturday afternoon. It is my privilege and honor to introduce Dr. Bharat Gummadi, our guest speaker for today. I not only know him as a cardiologist, but also as a personal friend and also as my best friend's husband. He completed his medical school in Granada at St. George's University and subsequently did his internal medicine residency and cardiology fellowship both at University of Florida in Jacksonville. He is board certified in internal medicine, cardiology, interventional cardiology, vascular medicine, hypertension, and congestive heart failure fellowship. He's been in private practice in cardiology for over 10 years now, and he has held multiple leadership roles. To name a few: past cardiology board member, past peripheral arterial disease director, past cath lab director. And so he is extraordinarily talented, as you can see. And he has a keen eye for lifestyle changes and initiating his patients to embrace lifestyle changes in spite of being an interventionalist himself.
Vanakkam, Namaste, greetings to all. I would like to inform you that every day we are doing meditation for world peace and harmony at 9 a.m., 11 a.m. and 8 p.m. UK time. I would also like to mention that we can be proud that we have achieved 673 days of daily meditation 3 times a day, for which we are very, very grateful to all those who contributed to this achievement. Now, I will pass this platform to Arundhati Master to conduct the meditation. Thank you very much.
Greetings to all. Thank you very much for attending this meditation session. Meditation is all about being in the present moment, observing, acknowledging, and accepting whatever is present in that moment. It is about living each moment completely. Just this small understanding carries immense power to change the quality of our life. A regular practice of meditation disciplines our body. It disciplines our nervous system, heart, and brain. It disciplines our emotional body, and it makes our mental body focused, concentrated, awake, and creative. Makes us mindful of all our actions in a state of refined awareness. The practice helps us produce better results in our daily life. We become more efficient and live in each moment, enjoying in the fullest. Now we will get into meditation. Please take a comfortable position. If you are sitting on a chair, sit comfortably. Feet should be crossed like this. Interlock your fingers and place it on your lap. Close your eyes and observe your normal, natural breathing. Whenever thoughts come, please come back to your breath. When we are with our normal, easy breath, the mind becomes rather empty. Once our mind becomes empty, the cosmic energy enters into our body. Once this energy starts entering into our body, our performance level will increase and we will be able to deal very efficiently with any situation in our life. You will find peace and tranquility within yourself, and great joy and happiness will be in your life. We can bring about such a changes in our mind and keep our thoughts always powerful. There will be a background music to relax your mind. We will meditate for 30 minutes. Thank you.
Vanakkam, greetings to all. We thank everyone who took part in joint meditation today, focusing on peace of mind, psychological healing, and for the world peace and harmony, with the blessings of the cosmic power. When we meditate jointly, it helps to generate a social force that spreads across all nations around the world, promote peace and harmony, and in general well-being to everyone around the world. Our sincere thanks to Arundhati Master, who conducted the meditation today, and for the calming music provided for the meditation today by Darshini Udayaraja from Liverpool, England, and to Mrs. Bhavani Vigneshwaran from London recording this event, and to everyone who participated in this joint meditation today. We would also like to thank PSSM Tamil Europe, PMC TV, which is part of PSSM Global. May the whole world be blessed with peace, harmony, prosperity, and well-being. Vaalka Vaiyagam, Vaalka Valathudan. Now, I will pass this platform to Professor Simurta Durarajan from US. Thank you very much.
That was a wonderful meditation session to kick off Saturday afternoon. It is my privilege and honor to introduce Dr. Bharat Gummadi, our guest speaker for today. I not only know him as a cardiologist, but also as a personal friend and also as my best friend's husband. He completed his medical school in Granada at St. George's University and subsequently did his internal medicine residency and cardiology fellowship both at University of Florida in Jacksonville. He is board certified in internal medicine, cardiology, interventional cardiology, vascular medicine, hypertension, and congestive heart failure fellowship. He's been in private practice in cardiology for over 10 years now, and he has held multiple leadership roles. To name a few: past cardiology board member, past peripheral arterial disease director, past cath lab director. And so he is extraordinarily talented, as you can see. And he has a keen eye for lifestyle changes and initiating his patients to embrace lifestyle changes in spite of being an interventionalist himself. So today he is going to share his transformative experience and how he was able to embrace lifestyle changes and really reverse a lot of metabolic complications and also his journey towards a healthier lifestyle. Over to you, Bharat.
Thank you. Thank you so much. Thank you for the invitation. Thank you for the wonderful introduction, Smrita. It's good to see you.
Good to see you too.
So thank you for all the participants. Dr. Chakalingam asked me to describe my journey into this new lifestyle, which I have been actively participating in for myself for many months now, but I have been advocating this type of lifestyle to my patients for many, many years. I'll give you a little bit of background history on my experiences and what I've done up to this point. As Smrita highlighted, I started my cardiology career as a heart failure fellow. I had a passion to see how we could treat not only patients suffering from severe heart failure disease with medications, but also with lifestyle interventions. And through my studying, it led me to a course of finding a passion to do interventions. The reason why I spent my last 25 years studying interventions I see the outcomes of bad lifestyles affecting younger and younger people. And the end result is they suffer from myocardial infarctions, heart damage that eventually leads to heart failure. And in practicing what I do, I see the tragedies that can occur with such lifestyles. I try to help patients in the office to recognize some of their choices. We have taught them many opportunities in choosing different lifestyles in regards to the exercise regimens that they do, but also the food choices and the mental aspect. And the very limited time I have with patients, some patients will understand and other patients take a little bit longer to understand the philosophy and the changes that they need to take on in order to better their lives. And me, myself, got to a point where life was getting very difficult, very busy. Being a practicing interventional cardiologist, I have very odd hours. I work 8 to 8 on most days. And if I'm on call, I'll be called in the middle of the night for any kind of emergencies. And then I'm expected to be at my full attention the next morning at 8 o'clock to take care of patients in the hospital as well as in the office. So life can be very demanding. But over the years, I've also have got into leadership at the request of the hospital and other colleagues of mine. And so not only was my interventional schedule very busy, I started to wake up at 6 o'clock in the morning now to have a meeting. And sometimes I'll have 2 meetings before I even getting into the car to drive to the hospital. And then after my full day of work, I had more meetings. And so my day eventually started at 6 with meetings, full day of work, ended with meetings. I'd get home sometimes at 7, 8 o'clock at night. And life was just getting very busy. And in that busyness, you forget about yourself. I found myself unrealizing what I was doing, snacking, rushing through. I was always tired. I was drinking coffee just to stay awake. It just gets busy. Life gets away with you. You forget things. So we've known Anand for quite some time. I've known his passion about the High Life program that he has cultivated. And he came to visit us, and we were able to discuss our practices, our cardiology practices. And in that meeting, he introduced a lot of concepts that was more scientifically based on all the things that we as cardiologists think are the most important things for patients to follow. But he was able to cultivate and produce and show the scientific benefits of following a lifestyle that is very mindful and very thankful. And be it as it may be, coincidence, if you want to call it, but I think I was at a stage in my life where I also, with all the bad choices I was making, I was weighing almost 230 pounds. My lab work was showing that I was becoming pre-diabetic. The blood pressure, I was not someone that always checked my blood pressures, but I could see the signs. I see it in my patients, and I was seeing it in myself. So when it got to the stress, I decided to back away from all the meetings that I was attending. Family life was being affected. So when Anand introduced me to this program, I was very interested in the scientific benefits because it helps me understand exactly what this process is. And it's hard to really relay this to patients when you talk philosophical, especially in the United States. A lot of patients have, in the South where I live in Florida, they have their own religious backgrounds and own thoughts, and to try to introduce a concept of this nature to them is sometimes very difficult. So having science behind it, because it's easy to understand a concept when you have science. And what Anand was able to do, he was able to lay it out in a way that was very easy to understand. And so I try to take that knowledge into my patients when I see them in the office. And a few patients really did understand it. They like the knowledge. You know, my patients are very adept at going to Google. Google MD is their source of information. And so they do pick up a lot of information. They do read a lot. And so when I was able to provide them with scientific knowledge and sources and resources and papers, they were able to understand it and adapt to some of these concepts. And so at one point, I decided when my life was getting to a stage, I decided to do it. It was a hard transition. It was an interesting transition. I didn't pick a date. I didn't pick a time. I decided after our visit together, and with his helping hand, he introduced it to me, and we I decided to go in a little bit more than I guess most people do. So when we were talking about intermittent fasting, which I do talk to all my patients about, and I see the benefits of intermittent fasting, but what I ended up doing, and this is my own personal journey, was I decided to do a 24-hour fast every day. So how I did it was I'd wake up, I would supplement my day with a coffee or just waters all day. And being as busy I was, it was quite surprising to see how everything just changed to a way that I didn't expect. Not having the nutrition, not having the food, not having the energy sources, the sugar rushes to keep me going. You know, in my life, food was something that I never paid attention to. It was, I have to get enough energy in before I jump into another case, or I have to, you know, put down a lot of food or drink a lot of coffee and just to move on, keep my day going. That was my mentality. And when I was actually mindful enough to say, no, I'm not going to do that, and change it to just being able to take things a little bit slowly, be more present in the moment, I found myself to be more efficient, more attentive, taking care of patients in a more efficient and more responsive way. I never lost an edge at the table when I'm in the middle of these procedures. I was more alert. So as days went on, I was becoming more efficient. I was stepping away from the leadership roles. I was coming home early. I was practicing exactly how I wanted to practice, but not only telling my patients, but I was actually living what I was telling my patients. But that missing element of me feeling how I felt, going through the emotions, being mindful, doing all the things that I never thought I could explain to my patients, all of a sudden I felt and was able to relate. And our sessions, if you want to call them, in the office became more meaningful. Patients who responded, I was able to relate. We shared experiences. So I've been on this journey for 3 months. In that time, I've lost 25 pounds. Yeah, about 25 pounds. And that was just coincidental, right? That's just the lack of calories, but the way it made you feel, slowing down, being attentive, being more aware of things, being mindful of what you're doing, being mindful of what you're saying, being very mindful of what you're doing with your hands at the table when somebody's undergoing a heart procedure, was something I didn't expect. So when I felt it, I was able to pass on that sentiment to my patients. And I think I was able to convince probably 30% of my patients who either have heart failure or have suffered a massive heart attack and developed heart failure to adopt this new practice. They've actually lost weight, felt better, and I was able to reduce almost half of their medications that they were on because of their cardiac illnesses. So seeing the transformation that I went through, being able to pass it on to my patients, being able to help them live a more mindful and peaceful and healthier life, kind of goes back to why I got into what I did. I started my career as a heart failure fellow, and I moved on into general cardiology, and I moved on into specialize into vascular medicine. So I spend most of my days in a lab trying to take care of problems that may or may not have occurred if patients actually adopted these lifestyles much sooner. I live in a world of where blood vessels clog up. So if they clog up in the heart, they cause a heart attack. If they clog up in the legs, or they clog up in the renal arteries, or they clog up in your neck, they can cause strokes, or they can cause end-stage renal disease, or people can lose legs. So everything that I've learned to master in my skills to treat the problem that could have been solved much earlier if we can get patients to understand exactly how to change their lifestyles in terms of what they do and how they do things, and be mindful and be grateful. Not to put myself out of business, but that's exactly where I think all of this stemmed from. I think it was the culmination of what I do, what I see, what the end results are, and how it affects patients, kind of led me onto my journey to make this decision to do it for myself, so that we can share the experiences with our patients on a more personal level, which I think makes a huge difference. Anand was able to introduce the concept. He was able to pass the knowledge in a very scientific way for me to understand, allowing me to pass it on to my patients. And with each other guiding us, I think we're making quite a difference in patients' lives, made a difference in my life. So that has been a step that I think I've been wanting to do for a very long time. But I think it was with the encouragement and the passion that Dr. Satha showed me that convinced me that you can do it. If I can do it, anybody can do it. So I'm happy. I'm grateful. I'm blessed. And that's kind of my journey. I'm very happy to answer any questions, any thoughts, any other topics. So, but thank you for the platform. Thank you for allowing me to share my story and my transformation.
Thank you very much, Dr. Bharat, to sharing your personal experience about your heart failure and how you have come completely from that, and how Dr. Shokulingam and you and work together to bring your life back and how you are having fasting for 24 hours and your lifestyle has been changed, and now you're passing to your patients as well. Thank you so much to sharing your knowledge and everything. Now, Kumar Sai, I will invite Kumar Sai Pilla Master to summarize your speech. After that, we'll go for the question and answers session. Thank you, Doctor. Thank you. Thank you.
Thank you.
அனைத்து மாஸ்டர்ஸுக்கும் எனது மனப்பூர்வமான வணக்கம். இதுவே டாக்டர் பாரத் குமார் அவர்கள் தன்னுடைய சொந்த அனுபவத்தையும் எப்படியாவது மற்றவர்களுக்கு கொடுக்கக்கூடியதாக இருக்குன்ற ஒரு உரையை ஆற்றினார். அதன் தொகுப்பை உங்களுக்கு வழங்க விளைகின்றேன். முதலாவது நான் என்னுடைய வாழ்க்கையை எடுத்து பார்த்தேன்னா 25 வருஷமாக இருந்தது என்னுடைய லைஃப் ஸ்டைல்ல பல மாற்றங்களை காணக்கூடியதாக இருக்கிறது. இப்ப இதுல இருந்து என்னுடைய ஆதங்கம் என்னென்றால், இன்றைய இளைய தலைமுறை அவருடைய வாழ்க்கை முறையை நன்றாக பேணவில்லை என்பதுதான் என்னுடைய கருத்து. முதலாவது நாங்கள் எப்பொழுதும் வாழ்க்கையிலே உடல் நலத்துடன் இருப்பதற்கு நல்ல வாழ்க்கை முறையை தேர்ந்தெடுக்க வேண்டும். அதுல உங்களுக்கு எல்லோருக்கும் தெரியும், ஒன்று உடல் பயிற்சி, உடல் எந்த நேரம் உற்சாகமாக வச்சிருக்க வேண்டும். அடுத்தது உடல் சார்ந்த சில பயிற்சிகளும் இன்றியமையாதாகும். எனக்கு ஆரம்பத்திலே என்னுடைய வாழ்க்கை மிக சிக்கலாக கடினமாக இருந்தது. மிகவும் கடுமையான உழைப்பு, எந்த நேரம் வேலை செய்ய வேண்டும், காலமே காஃபி குடிச்சிட்டு ஒரு அலுவலகத்துக்கு போறதும், அங்கே கூட்டத்துடன் நாளை ஆரம்பித்து கூட்டத்திலேயே முடித்து அப்படியாக ஒரு சொல்ல முடியாத ஒரு கலப்பு மன அழுத்தத்தோட வாழ்ந்த எனக்கு என்னுடைய வாழ்க்கையில மாற்றம் ஏற்பட்டது. அப்பொழுது என்னுடைய உடல் நிறை 230 பவுண்ட். அது மட்டுமில்ல, நீரிழிவு கூட இருந்தது சாலையாக. அடுத்ததாக நான் குடும்ப வாழ்க்கையை நான் அவ்வளவு கவனிக்கவில்லை, அவ்வளவு அக்கறை எடுக்கவில்லை. அப்ப இதே இப்படியான ஒரு வாழ்க்கை வாழ்ந்து கொண்டு இருக்கும் பொழுதுதான் என்னுடைய வாழ்க்கையில் ஒரு மாற்றம் ஏற்படுறதுக்கு ஒரு வாய்ப்பு கிடைத்தது. என்ன செய்தேன் என்றால், எதை செய்த பொழுதும் அதை முழு கவனத்துடன், அதாவது நிகழ்நிலை செய்ய ஆரம்பித்தேன். அப்ப அந்த நிகழ்நிலையை நான் செய்யும் பொழுது என்னுடைய ஆற்றல் மிக கூடியதாக இருந்தது. அந்த ஆற்றலை, இந்த அனுபவத்தை நான் என்னுடைய நோயாளிகளுக்கும் கொடுக்கக்கூடியதாக இருந்தது. இப்ப எப்பொழுதும் நீங்கள் எதை செய்கிற பொழுதும் அதில் உங்களுடைய முழு கவனம் செலுத்த வேண்டும். மற்றது, அப்ப இப்படியான ஒரு வாழ்க்கையை வாழ்ந்து நான் மட்டுமில்லை, என்னுடைய நோயாளிகளுக்கும் இதை கொடுத்து அவர்களும் பலவிதமான உடல் நலம் பெற்று எந்த விதமான சிக்கலினால் வாழக்கூடியதா இருந்தது. என்னை பொறுத்தவரையிலே நான் என்னுடைய உடல் நிறை குறைந்தது. அதோடு மட்டுமில்லை, பல மருத்துவர்கள் நோயாளிகளுக்கும் இந்த அனுபவத்தை கொடுத்தேன். அவர்களுக்கும் பலருக்கு மருந்துகளை குறைக்கக்கூடியதாக இருந்தது. அவருடைய உடல்நிலை குறைந்திருந்தது. மற்றது, இந்த வாழ்க்கையிலே ஒரு அனுபவத்தையும் அவர் காணக்கூடியதாக இருந்தது. மற்றது, இந்த வாழ்க்கையை நாங்கள் மாத்தினக்கு, என்னுடைய வாழ்க்கை முறையை மாத்தினு சொன்னேன். முதலாவது நாங்கள் வாழ்க்கையிலே செய்கிற ஒன்றையும் முழு கவனத்துடன் செய்ய வேண்டும். அடுத்ததாக, நன்றி உள்ளவர்களாக இருக்க வேண்டும் எப்பொழுதும். இந்த முக்கிய குணங்களை நாங்கள் கற்றுக்கொண்டதால, அதோ மட்டுமில்லை, என்னுடைய நோயாளிகளுக்கும் நான் பகிர்ந்து கொண்டதால அவர்களும் இப்படியான ஒரு உயர்ந்த கோட்பாட்டுடன் வாழத்தக்க இருப்போம். இப்ப நான் மிகவும் மகிழ்ச்சியாக இருக்கின்றேன், நன்றியுள்ளவனாக இருக்கின்றேன். எல்லாம் பெற்று மகிழ்ச்சியான ஒரு மருத்துவராக வாழ்ந்து கொண்டிருக்கிறேன் என்று கூறி, இப்ப நீங்கள் கேள்விகள் கேட்க இருந்தால் அதை கேட்கலாம் அப்படின்னு செய்கின்றேன். நன்றி.
Thank you very much, Kumarasamy Master, for summarizing the speech now. And anybody wants to ask any questions, please raise your hand. And I would like to ask, first I'll come to Dr. Bharat. You said you were fasting for 24 hours. That is it in a week, or how did you do that?
I actually do it every day. So I have my first meal is my dinner, and I usually break the fast with a fruit. And the other thing I decided to do this year, my New Year's resolution was become 100% vegetarian. So I'm actually learning how to be eating full vegetarian dinners as well. So after my meal, the rest of it is just waters. And in the morning while I am working, it's a coffee in the morning, fluids throughout the day. I may have a coffee or so at lunch, but other than that, my first meal is as soon as I get home, and repeat it. Same time around 6 o'clock, I'll have a fruit and then my dinner. And then I try to get at least 8 to 10 hours of sleep nowadays, which I wasn't able to do before. So that's how I've been physically doing it on a daily basis. And I started off that way. That's how I first started. I didn't ease into it. I didn't change from 1 meal or 3 meals to 2 meals to 1 meal. I decided this is how I was going to start, and that's how I've been doing it every day.
So straight away you started the 24-hour, that is intermittent fasting, yeah?
Yes.
In between you don't eat anything. You have some fruits or something like that?
No, nothing. Just fluids, coffee or waters.
So you have 1 meal a day. That's correct?
1 meal a day. Yes.
That is nighttime you have a meal, then next day in the night only you will have the meal again. In between you have only water or coffee. Yeah,
yes.
That's Yeah, I can see a mridangam behind you. So you are spending your time leisurely, or you are playing the mridangam? Because I
No,
can.
those are my kids. They both play mridangam, so
Okay,
that's
thank you, doctor. You have, you have how you have changed your lifestyle, and you have been mindfulness all the time. Whatever, yeah, that's what we are doing at the moment. Whatever you do, you have to do it mindfulness. Whatever you work, you do it in a mindful way. So everything, yeah, we can change our life. Thank you so much for your experience, to sharing your experience. Thank you. There are so
thank
many
you.
hands out there. Thank you so much. Thank you.
Thank you very much. The next is Mr. Panjacharam, the president of Sydney Tamils Association. Thank you.
Thank you, everybody. Thank you, Dr. Bharat. Today you have given us a very, very good, very encouraging speech. It was very useful to our group. I have one question, Doctor. You have said you change your life by coming to mindfulness. This mindfulness, from where do you get? From religion or from this group like meditation group? Or there are so many people talking mindfulness. Doctor, can you explain to us how do you get this and how you got into the mindfulness?
Good question. It's a great question. I think everyone's source of inspiration or source of knowledge comes from multiple ways. I think for me, the mindfulness was the lack of mindfulness. I think I recognized that I was losing touch with a lot of different things that I was handling, be it both at work and at home. And I think with Dr. Chucklingham's help, being able to recognize that slowing down and being in the moment of what we're doing, there was one thing he taught me. He said that when you do break your fast and you do decide to eat very slow. Now that's very, very, very difficult for me. Being an interventional cardiologist, always on the run, always on the move. I was grabbing food very quickly. I was putting it in my mouth very quickly. I had to, we would go to the bathroom very quickly, get to the cases and take care of things, and that was life. Life was always in 200 miles an hour. And I think the one lesson he said about the food, and we went to dinner and he asked me, slow down, chew very slowly. And at that moment, I realized that was everything I was doing. Everything I was involved with was at full speed. I never really slowed down to understand exactly what I was doing. And it's that moment that really trued me. Just be in the moment, be very mindful of the action that you're doing. And that's how I carried it on. That's where I woke up, in essence.
Yoga. Thank you, Doctor. This your answer lead to another question.
Yeah.
Is it possible shall I ask you?
Yeah.
This food pattern you have changed. So this food pattern is due to this mindfulness yoga introduced to you, or your life, your medical line has given to you to change this food pattern?
Both. As physicians, we learn what the body can do and what the body can handle. I think growing up in an Indian home, eating predominantly vegetarian, we understood the benefits of having a vegetarian diet and then a healthy diet. But what we don't learn too often in medical school is how the diet and how we choose our foods and the impact of the nutrients that we put in our body. That's never really taught to us, especially to some of the general practitioners or even the cardiologists and so forth. But when taking the knowledge that I had and understanding it with what I know can make your body healthy and prevent some of the things that I was treating as a physician led me to all of this understanding. And it was more of self-inquiry, trying to learn it on my own and trying to discuss it with my patients, because my goal as a physician to all my patients is, and I tell them, if I can teach you to make the right choices in terms of your food and your peace and your mind and your exercises, which I think are the 4 basic tenets of healthy living, then I can actually hopefully make you feel younger, reverse some of this disease process that's already started, but yet take you on a path that you can carry on and prevent this and hopefully not have to take medications. And that's kind of been my basis for everything that I do with my patients.
Yeah, thank you, Doctor. And me also trying to change our pattern of because before coming to, as far as myself concerned, before coming I eat little more. Now I have reduced and going on. Thank you, excellent speech. Thank you, Doctor.
Thank you. Thank you.
Thank you very much. Next is Galaxy Note 8, please. May I know your name and where are you speaking from? Thank you very much.
Is it me, Rajesh Bala?
Rajesh Bala, okay.
I'm sorry, I don't know why it's a Galaxy Note. I don't know what it is. Sorry, I'm not coming to the video because I'm resting in bed because I have just done my walk and just came home. I just wanted to say thank you to Dr. Bharat. Dr. Bharat, I'm a retired health promotion officer. My point of view, the speech, what he has given, I think Mr. Panchalingam, about the children, the problem at the moment, as Dr. Bharat said, he came from an Indian background and he's working in America. The challenges are tremendous. So our kiddos, they are born here, but still they are not British, they are Tamil kids. So when they go to school, they had to face a hell of a lot. The food practices and the exercise and everything. It's a mindfulness that starts from home. So somebody said nobody taught us what is a healthy eating. Nobody taught us. But what we were when we were in our villages, that is a healthy eating. Because don't do this, don't do that, don't eat that, don't eat that. So they all been taught us. Now I'm over 75 now. I tell my grandson at the moment, your mind and body, you are the controller of your mind and body. You are the captain of your ship, your journey. So he's 14. Grandma, when he was 5. I remember your mantra. Now he's telling. So what I asked him to do is not only education from the school, education from your family, your friends, because we're the gifted people in England, because we are here with the people who speak 300 languages speaking people in London alone. So we can learn from each other. I have friends from God knows how many countries. This is the things we had to give. Dr. Bharat gave the mindfulness, getting experience from our life with others, the food, our tradition, which all are within us. So we shouldn't let ourselves go. So that is a victory in the life. That is a successful in life. So what I do, I'm still writing, still publishing. So these are the things we had to learn. Thank you for the lovely contribution, Dr. Bharat. I'm sorry about my name. I don't know why it came Galaxy Master Srikant. I don't know what it is. I'm so sorry about it.
Okay, that's fine. Okay. Thank you very much.
Thank you.
Next is, thank you. Sivachandrika Master, you can.
Hello, hello, Dr. Bharat. I was hearing all your things. Beautiful. How you was suffer before, how you met the pressure and everything. When I come this country, me too. In beginning of my life was more than horrible because of the lifestyle. It made me to busy life. The end of the year, the price is stress. So I couldn't escape from the stress. So I away from the natural life. After long time suffered, so I started to do meditation. So which make me to stay with the yoga, meditation, natural life. So I started to enjoy my life. I would like to ask you, because you are a cardiologist. We started recently here clapping therapy, laughing therapy. In my life as well, changed this kind of therapy. This kind of therapy and your knowledge of cardiologist, how do you feel? Tell me, we are doing now. Can you talk about the therapy, clapping therapies, laughing therapies, and what of the between our vascular system, circulation system, and our heart? We are really enjoying.
Yeah, a great question. You know, all of these provoke an immune response, and I think I don't know of a lot of connections, forgive me, between the actual cardiovascular benefits and the clapping and the laughing therapy, but I can tell you from the things that I understand is when we use the muscles, the smiling muscles on our face, it does relieve hormones, healthy hormones. These are hormones that help dilate your blood vessels. It decreases your blood pressure. It decreases the stress on your heart. Your heart pumps more efficiently. You're able to distribute more blood through your extremities. And the clapping motion, it's the same thing, because when you're clapping, you're thinking happy thoughts. You're clapping, you're rejoicing. It's the same kind of chemicals that are being redistributed in your body to a more relaxed state. It's altering your immune system. It's altering your sympathetic and your nervous system. In essence, it is providing you with more calm state. So they do work. I've had multiple people tell me the benefits of this type of therapy for them. So good.
Thank you, Dr. Bharat. This question I made on behalf of our this meditation group, because when I asked straight away, you express this is good for immune system. Yeah, definitely 100% immune system, and is providing more secretion, endorphin, dopamine, oxidation.
Yes.
One more I forgot. Each happy time we have endorphin. So we lose because of our stress period. We lose with the stress. It is decreasing our hormone level. Happiness increasing our hormone level. We lost this one. Now this meditation group doing this therapy, so much change. I am one of the person as a example. Thank you very much. What I expect from you, that answer I already know, the question for all of us. Thank you, doctor.
You're welcome.
Thank you very much. Next is Kala Sivakumaran. Thank you.
Hello, doctor. Thank you so much, Dr. Bharat, for this very inspirational speech. I admire you for what you have done with your life-changing plans with intermittent fasting or 24-hour fasting, or both.
It's kind of, I'm doing the 24-hour fasting. I talk about intermittent fasting with my patients, but I do the 24-hour fasting. Yeah.
Yeah. So, well, I'm 75, and I have diabetes for 15 years now. So so I take medicine. I'm actually insulin. I take insulin morning and evening. So because of that, I don't know how easily I can follow the 24-hour fasting. Or maybe I could try intermittent fasting. I have also listened to a speech by Mr. Madhavan. He's a film actor. he once spoke about drink your food and eat your water. So you chew the food to such an extent it becomes liquid.
Yeah.
So you drink the food and then you eat the water, is drinking it slowly. So, and he did say that it makes the life-changing exercise is that. But I have tried that and I have given up on it because it's so difficult, chewing, sitting and chewing. But I think with the way you were explaining about your fasting method, and when somebody asked you a question, how you take your food, and you did say that you have to eat slowly. So there is some truth in it, I guess. But it is quite difficult to achieve. So you must have a very strong mind. I don't know. It's I feel, and also the previous speaker spoke about children's food habits. I have 5 grandchildren, and one of them, 6-year-old boy, he doesn't take vegetables at all. It is all this fast food, sausages and chicken nuggets, whatever, and potato chips and pizzas. So no, he himself would tell me that he is eating bad or unhealthy food. But the parents, with their work pressure, I think they are unable to spend time to or fight with him, because he's very stubborn. Even if his mother says, no food, this is what you have to eat. If you don't eat, that's it, no food. He would gladly go and sleep. So it's difficult to, some of the things that you have achieved, I find it very difficult. So maybe, I don't know, you are an inspiration. Maybe there is a lot to learn from your example.
Thank you. Yeah, I think it's where life leads an individual. Even with my children, I know there's going to be a point in their life they're going to come to a realization that what I was saying or my wife was saying to them all these years will all of a sudden hit them, and they'll realize I should have listened to them, And I think I was at a point where, coincidentally and luckily, Dr. Chucklingham happened to be with me and we were talking about these things. And I was at a point in my life where I knew I had to make a change. And he gave me a very insightful way to do so, in a very way that was easy for me to understand. And it made sense. And I was ready to understand it. I was ready to take on the information. I was ready to adapt because of everything that had accumulated up to my point in my life at that time. So I think I was needing it. I think in my mind, I knew that this was the right thing to do. Like our children, we tell them to eat vegetables. They won't. But in their mind, they know vegetables is a good thing. At one point, at some point in their life, they're going to realize, I should have done it. I will do it. I'm going to do it. And they sometimes have to come to it themselves. It's like letting every child fall. Only when they fall do they experience the pain, so they know not to do it again. I think there's some advantage to that, but I also believe that giving guidance, showing them, that may not be the right way to do it, but trying to help them is also valuable. But there is something about life experience. I was not able to teach my patients any more than what science told me until I felt it myself. When I went through the process myself, I was able to expand and create a new dimension when we talk in the office. So the experiences are very important. And so, no, I hear you. It is very difficult to see what kids do and try to shape them, but I think eventually they'll realize that we, as my wife and I, we've always made it a point that during mealtime that we all, as long as all 4 of us are together, we always sat together. We never allowed people to separate. We never allowed them to do their own thing. There was our time food and meals was our time to really talk, to catch up, but also enjoy the meals that were given to us. So we made that a habit. And I think kids responded to that very well. But yeah, they do. My kids still eat a lot of junk food at home if they're not with me. But at home, we try to introduce and keep our traditions and the concepts that we all believe in. So,
Come here. Thank you, doctor. Thank you.
Thank you very much. Next is Yogi Nagendram Master from Reading, England. Thank you.
Greetings to you all. Dr. Bharat, and your talk was fantastic. It was very inspirational as well as educational. What I would say is that all the things what you said in order to prevent that cardiovascular disease, or after that, or is it combined? That's my number one question. And somebody is not overweight and vegetarian and active, still that person can get the cardiovascular disease. In that scenario, what sort of advice you can give for them? And also the age factor. When you're young, you can cope with that fasting and so on, and in order to prevent, but you're already diabetic, as the lady said a few minutes ago, diabetic, and if you are existing the illness, therefore, how you can control it?
Oh, great questions. So the cardiovascular diseases, there's two components. So genetics, unfortunately, have a major role, and nothing's modifiable with that. However, what we choose to do as we grow up and throughout life, and how we deal with our body, the stresses that we put on our body, physical stresses, meaning the food we eat, the insult, the inflammation, can really potentiate the risk of somebody having genetic factors. And so they can have more problems much sooner. Whereas if you are healthy your whole life, you did the right thing, you can still get the disease because of your genetic factors. You have a very strong tendency for plaque buildup, or you have a strong tendency for some type of weakness in the vessel walls that can lead or more prone to damage. All of that is not in your control. Where the example of you saying, I'm healthy, I do the right things, I eat well, and so forth, and I still have cardiovascular problems. There's a component that I've been trying to understand and discuss with my patients, and that's the mental aspect of this. The mental aspect, there's the physical aspect, what you do on a daily basis, how you treat your body, what kind of food you give it, the energy sources you provide it. None of that is talking about the mental aspects, your mental stressors, your mental daily life, how your outlook, what it is that you do, because that is a direct connection into your body and your body's ability to fight disease and your body's ability to repair itself when it is damaged. And I think that is one place that I think a lot of folks, even young folks, they deal with a lot of stress in life. There's mental disease that is unrecognized and untreated for many, many years. And that itself can lead to tremendous stress on the body, that even though there are excellent choices in life, eating healthy, eating vegetarian, and exercising, that stress alone, it can be very detrimental and lead to early problems, especially in the cardiovascular disease. And there are many people that have published articles on how the mental stress and inflammatory markers in your body are connected, and those inflammation can lead to further cardiovascular disease progression. So all is true. And I think we as clinicians and we as friends and family members have to be able to recognize it's not just the physical aspect of what we do, but it's also the mental aspect of what we do. Being very proud, being very supportive, being affirmative, giving each other positive feedback, lifting each other up, making sure that everyone is doing okay. That's where the community comes in. That's where a family member comes in. That's where a friend comes in. And being able to tap into all of those sources is just as important as them making the right choices in what they eat. So I think it's the whole package. It's not just one or the other.
Yeah, it's all combined, isn't it? Thank
Yeah.
you so much. But a small question. So if somebody is suffering with similar things and the dietary and physical fitness and all is going on, and is it possible for that person to still can get into anemic stage, like by fasting and so on?
Yeah, that
Then
is true.
what sort of guidance you can give for in the dietary way?
So I think the moment you give your body nutrition, depending on what it needs, and if I understand for diabetics, it can be very difficult because of the fluctuating sugars and the way their pancreas is able to and the sugar levels and insulin secretion and the absorption, it varies throughout the day. And for them, whenever there's any fluctuations, they have to be able to understand that and be able to supply their body with what it needs. And I think intermittent fasting, like you said, it does work for people that have the tolerance to do so. But when there's a deficiency in the body, be it anemia or the ability of your body to produce red blood cells, if it needs iron or if it needs other supplements, making sure that your vitamin Ds and your calcium, your B12s and your iron levels and all of these things are supplemented in an appropriate way, but also providing yourself in the meal the right nutrients that can help boost those things that you're missing. Because as we age, all of those factors will play a role. There's going to be issues with osteoporosis, or there's going to be issues with mineralization, and you're not able to produce those supplements. So being able to recognize it and still supplement yourself either with the food that you eat and the choice of the food you eat, or providing yourself with the supplements to make sure that can continue to be boosted. So yeah.
So you have to be aware of all these, all the side factors, indeed. Yeah.
And you can still be mindful in what you're eating. So some people have a hard time with intermittent fasting. They have this concept of, I have to eat at breakfast, I have to eat at lunch, and I have to eat at dinner. That is the way they work. That's how their office day works. The office day works where there's a break at 12 o'clock and everyone has to eat between 12 and 1, and then we resume our activity after 1 o'clock, and then we go home and have dinner. This is the lifestyle, the habit that they have created. And I think if you can choose where and when you want to eat, that's your choice. But making sure what's on that plate or in that meal is covering the basis of your deficiencies, absolutely important as well.
Yeah. Thank you so much for thank you.
You're welcome. Thank you.
Thank you. Next is Dr. Satha from Enfield.
Greetings to all. First, I wanted to ask one question, and then I wanted to mention a few other facts. How easy was it for you to change into intermittent fasting at the initial stage?
Easy. I made up my mind. Yeah, I decided that this is the way I was going to do it, and I was not going to accept for myself any other way. I did take a very extreme approach to it, but it wasn't a hard switch though, because some days I was not able to eat until the evening anyways. So it wasn't a major change for me, because if I was called in the middle of the night to do an emergency, it may have started at 1 o'clock. I finished the emergency at 5 o'clock. Then I'm expected to be at work at 8 o'clock and then do a full day. So there would be days where I had no chance to eat or drink or do anything. So I think it wasn't a big change for me.
Yeah, I can understand that. There have been some days I used to take my meal, I bring it back home. That I have done.
Yeah.
I didn't have time to eat anyway. When you said that most of the doctors were not taught in the medical school all these things, I think I was lucky if I had some acquaintance to some conference on nutrition. One of the nutritionists, a friend of mine, she used to come to as well. She used to run nutrition conferences I have attended, and it was an American company, part of the American company, and they used to make all these organically grown vegetables and making supplements, etc. And I think that was one of the reason I had, I was a vegetarian most of the time, that I was lucky enough. But after meditation, of course, I'm complete vegetarian. I have changed. I feel I'm healthy and everything. I'm looking after myself. One of the other aspects we all have is when doctors say it is a borderline diabetes, people tend to think it is okay. And it is borderline, it's only borderline. I'm not really diabetic, it's borderline. My doctor said it is borderline. So that is how people take it. And they don't bother about it. After that, so I know a lot of my relatives, friends, and this is what they say. A doctor said borderline, so they carry on eating all the unhealthy food as what they were consuming before, however much you say. And the other aspect is the willpower. So people are finding it so difficult. I think after coming to meditation, a lot of people will have, they can practice mindful meditation, mindfulness. Through that, they can make that change to make decision. And I wanted to happily say one aspect. I did a presentation on smart organs, and on that what I said was every organ is talking. For example, stomach is saying to the person, you have the teeth in your mouth, why don't you chew and send your food? I don't have teeth, so be kind to me, help me by doing this. So that's why every organ I was presenting, and I think most of the people liked it, the way it was. Actually, they were saying, they were suffering. They were saying, be kind to me. So we never think like that. We always eat what we feel like eating or how much. Chewing difficulty is another method that you will eat small portion at a time. You won't overeat. So that's a good method if you can practice. It is not tasty at the end of it, chewing for a bit longer time, but if for your health reason, I think I personally strongly suggest if people can do that, you can control your diabetes or any other kind of or prevent illness in general. Thank you so much for sharing your experience. Thank you.
Thank you.
Thank you very much. Next is Mr. Chandra from Atlanta, USA.
Good morning, good afternoon, and good evening, and thank you so much. Greeting to everyone. So doctors, your speech is very motivational. Thank you so much for sharing your experience, and all the best and good luck for your transformation journey. I have two questions, doctor. One is how you are managing your hunger in 24 hours time. And the second question, in a one meal, how you are managing your all the micronutrients requirement, doctor?
Good questions. Good questions. During the day, I manage the hunger. I recognize hunger. I do feel it. But when I wake up in the morning knowing I made a decision, and my decision was to fast for 24 hours. With that basis, I move on. I know that I'm going to be busy, and I lose my focus into what I'm doing. You know, I just move from one thing to the next thing, and I just keep doing what I need to do until I finish. And when I finish, I do know that I am going to be going home and eating that one meal that I wanted to eat when I woke up this in the morning thinking I'm going to have that good meal. In that meal, unfortunately, I don't do all the cooking at home. My wife does all the cooking at home. And so, you know, most of it is all vegetarian based. So I try to eat as many plant-based proteins as we have. And we do try to, at least the macronutrients, we try to get a good source of. The micronutrients, not so much. I mean, when I started this journey, that wasn't one thing that I was really focusing on quite yet. It was more of, can I do this? How am I going to do this? Will I still be able to get my macronutrients, my proteins and my carbs and the fruits and the vegetables in the same area and feel satisfied and fulfilled that I'm okay. Now, the micronutrients, those are things that I will need to kind of establish and kind of work on, but I have not done that yet. It's a good question.
Okay,
Yeah.
great. Great. Thank you, doctor.
Yes.
Thank you very much, Nick.